Hey guys, Dr. Watt from Pinecrest Chiropractic. Let's talk about how we adjust patients for hip pain and hip dysfunction. And so the first place that we're going to start and we're going to check with patients with hip issues is going to be the low back, especially when they're here already, because this is an easy way for us to look at both the SI joints and the lumbar spine. And so we'll palpate through those. Sometimes we'll use those drop tables where the table pops up an inch or so and falls back down to get force through. The other thing that we're going to look at while the patient's on their belly is going to be on these deep glute muscles. One of the most common ones is going to be your piriformis. So finding where that hip bone sticks out here and then sinking in right under the side of that glute or right on the side of the butt cheek there. That muscle is going to be really, really tight on a lot of patients. We see this a lot on patients like pregnant patients who are having lots of changes in their pelvis. Patients who don't have good range of motion. Once again, the piriformis is a big one. And so doing that release on that muscle is going to get that to open back up, restoring proper motion through there. We can also look at other muscles within the deep glutes and the hamstrings. All of these are going to contribute to how both the glute and the SI joints are working. So taking a look at those while we're here, then we're going to have you flip to your side facing me. And so then we're going to actually adjust her SI joint now, bringing her hip up and rolling down through. So this SI joint, where many people call their hip right here, is going to move with an SI or with a side posture drop here. Just like that, a little bit of force. Go flat to your back for me now. And that's going to restore motion through the SI joint and help the hip. Next, when we look at the hip specifically, we're going to have the patient on their back. We're going to look at a few more soft tissue things, like we can look at their psoas, which is going to be right inside this big hip bone here, where we're going to bring the knee up and we'll have a contact there to roll that out a little bit, as well as looking at the quad muscles. Go ahead and relax down all the way up into the hip and seeing if we need to release any of those. Once we get those muscles released a little bit, we'll move into adjusting the hip as well. Once again, we can use that drop table and check the range of motion where we'll roll the hip in or out and using that drop to drop through that once again. One of our favorite ones though is called long axis distraction. It's exactly what it sounds like. We pull on the hip, right? And so we'll find where their restriction is. We'll change the range of motion and give it a quick little tug. That gapping there is going to open up that ball and socket joint and get it to move again. Once again, get me back moving the way you should again. So these are some of the quick and easy ways that we adjust the hip. There's a few of the tricks we got up our sleeve if you're going to be a difficult patient, but that's okay. We'll figure it out with you. If you want to talk more about different ways that we look at and adjust the hip, come on in. Let's chat about it.